Message there. Okay, great. Thank you. So what we're going to do for the next about 10-15 minutes or so is kind of review some of the foundational concepts as we sort of prepare for a larger conversation here. And as you now know, we're basing this work on sort of three areas. We'll call it three pillars of interoperability. And that includes social determinants, the 6 different primary domains, and then of course systems engineering. We feel like these are, this is pretty conceptual stuff. And you'll see from the next module, if you looked already, but the third module of this course gets very practical and very concrete. These are, while they're certainly important and lend themselves to concrete application, they are more conceptual in nature, and that's a good starting point, I think, for where we're going right here. So just to begin with, I want to just share this image again. This is kind of this coordinated care conceptual model that I'm sure looks familiar to folks. I know we talked about it last time, but I want to just sort of refresh people's perspective on what we're attempting here, which is pretty ambitious in terms of not only supporting the individual domains in their missions to drive whether or not it's health or judicial or education, housing, those things, but of course, how do they interact with one another to support the individual and the family and the community now, but also across multiple generations. And I offer this, while I don't think this graphic is in the training itself, it emerged after that as part of the work we've been doing to implement this. It's very useful, I think, in my mind, a good graphic to be able to sort of share the concept quickly with other people and organizations and leadership. And I just want to make sure that kind of touch base on that, because it really, in many ways, summarizes and encapsulates what we're trying to do. As you'll see, this is really part of some other imagery that you've already seen in terms of the drivers and kind of the holistic perspective on how we're trying to address the issues here. So SEOH, not a new topic for folks within the context of the training. You will have seen some of the written materials and some of the interviews talking about it. And what I really wanted to do was to actually have a chance here to spend a few minutes just talking about SDOH in terms of how you and your organization sort of conceptualize this. And I use the term sort of mature. How mature is your understanding, both individually and organizationally, of SDOH? And has it been integrated into your organization? Are you doing that right now? Because I think once we start to talk about the various social factors, and I don't really love the word determinants, become a sort of a term of art. It's always one of the things that we can go into this work with an assumption that, oh yeah, I've heard the term 1,000 times, I know what it means. But of course, there are different levels of understanding, both individually and organizationally. But the bigger question is, how have your organizations actually adopted this? Have they? And have you been able to sort of work this into your program planning, your strategic planning, your assessment, how you judge and value the work you're doing? Again, it's another way of conceptualizing the various pedals on that pinwheel that I just showed. So, thoughts welcome here about the status of it. We could do a little polling, but I guess we didn't set that up in time in terms of how many people, use your emoji. How many people feel like you individually you've got or you can just raise your hand if you've got your camera on. How many people feel like you've got a good grasp of it individually of what social determinants kind of mean? This is an interactive section, so just kind of raise your hand or do an little emoji. That sounds great here. So a good number of people kind of got a sense of it. I think it's one of those things where it's, the headline says a lot of what's important here, but diving deeper into it, kind of reveals the complexity of how social factors actually impact individuals and communities. And I think developing a larger, a deeper understanding of it is important, which is, again, what we attempted to do is to sort of provide an overview here and provide some more references to go more deeply into that. Any comments, questions, thoughts at this point in time? Feel free to jump in. I would think this is
Daniel,
actually,
Lee has his hand up.
oh, hey Lee, great, sorry.
Oh, sorry, I just had my hand up for the prior one. Sorry
Well,
about
I'll
that.
lower your hand for it. That's what I assumed. James.
Hey, James Johnson, Solano County in California. I think that for us, and we definitely understand as like an organization what social determinants of health are, and I think that we acknowledge their importance. I think that we still don't necessarily take full responsibility for like making the linkages between the different between like those are social determinants of health, like the need for like housing to address food insecurity, et cetera, and like how that then impacts like long health outcomes and how to provide those things on not just kind of a sporadic basis, but on a continuous basis. Like I think we relegate ourselves to being like, I don't know, the stereotypical like weekend dad or weekend mom, where it's like, yeah, I get that you have these needs like throughout the week, but like my time is like Saturday and Sunday, and I'm not, and so although I acknowledge that those things are important for you, I'm not necessarily going to take the responsibility of like providing those things. Anyway, so I think that's one thought I have.
Thanks, James. Anita, I see your comment in the chat here. This is terrific. Having looked pretty deeply into census tracts. Do you mind saying just a few words about that, where you're using available information, either census data or other materials that you guys put together or
well,
made available?
This actually, in Arlington, the Public Health Department is part of our Department of Human Services. So every 10 years, we have been doing something called MAP, which is like a community health mapping process where we get all the stakeholders together and we do extensive amounts of surveys. But this last time, and we call it Destination 2027 because it started in 2017, the work started, and it was a 10-year look forward of, instead of looking at basically what the health problems are in terms of the illness proclivity or the proclivity of transmissible diseases and that, which is usually what would come out of these MAP processes, oh, we need to do more for STDs. Oh no, we need to do more for obesity. We looked at the social determinants of health, and there is a guy who comes out of Virginia Commonwealth University, Dr. Stephen Wolf, who published a report for our region of Northern Virginia, which is a very wealthy region, of the islands of disadvantage within Northern Virginia. And we got census tract data for ourselves, and we started mapping out, the different social determinants of health by census tract. And you can see, Arlington is small, but you can see exactly down to the census tract, down to the neighborhood, where people are faring worse on these different, domains, like, access to healthcare, access to childcare, limited English proficiency. And then we mapped that to their life expectancy. And there was a 10-year, we call it the decade of difference, 10-year difference from literally, you can cross the street from one block to another, and that, is the ultimate indicator of health indicator, life expectancy. So we use that a lot in terms of census tract to pinpoint where we should focus our work.
That's great. That's terrific. And I see from Jessica that Hennepin is doing something similar to that, the SHAPE survey, which is great. I'm always interested in other resources as people really look at this work, and we'll capture those, put those into the hub as a resource as well. So recently, same kind of question on ACEs here for folks. I know we didn't address ACEs yet in this training, and something we're talking about with folks in California at the California Alliance and others, but ACEs seems to be yet another sort of deeper level review that kind of sort of complements SDOH. Is that something, again, just to show of hands, that folks are sort of addressing or considering in your jurisdictions? Just to get a thumbs up or a wave, something like that. Yeah, so it's showing up in places. That's great. Thanks. We've got the Hennepin one here as well. We'll save the chat. That's
Misha,
great.
is your hand up for a question, or are you waving?
Oh, I just wanted to make a comment to Daniel's first question, but if we're moving on, that's okay.
Go ahead, take a moment.
So I just wanted to say that, so I'm Misha from Alameda County Public Health Department, MPCH unit. And in general, our county and our department is very mature in our understanding of social determinants, as well as we incorporate ACEs in our trainings and in our program operations. But the second question I realized was hard for me to answer while I was doing this activity because our systems are so siloed. I think, it's hard for me to really know what other domains are collecting in terms of these areas, and also in which format. So this whole training is exciting to me because hopefully we'll get some more details on how to actually share that information, right, and streamline it.
That's great. Yep, thank you. Yeah, and these questions are really meant, as we're thinking about it, because I know people are pretty familiar with the terminology. There's a depth of knowledge, a depth of literature around it. But the second question, which we won't go into now, is something that's come up over the last couple of years, which is we're sitting on information that we know is useful to other people, right? Education knows that they have attendance information that's useful to others, but either not motivated, incentivized to deal with it. And yet, also that you have information that you want information for other systems. So it's kind of almost like an as is and to be sort of in a way to speak about it, think about it. As you begin to have cross-domain conversations, what do we have? What do you have? How can we share that information? Because it's not known right now. And although we do need it in order to do the kind of integrated work we're talking about here. And so it's a worthwhile conversation. Again, these workbook reflections are useful as you come back to your organization, or if you go more deeply, or if you do strategic activities around it in any area, to really probe into that and see, because it's amazing what people are sitting on, that if they were almost to publish it, like we've got this, we've got tomatoes and cucumbers today, and you've got onions and lemons, right? So that we can really share that across domains. And it makes it a very sort of tangible way of doing it. It is also sort of flows into this idea of 6 domains as well. So SDOH is sort of embedded in this work. If you think about the various domains that are at least listed here, and as I mentioned, and as you probably saw in the either in the document, the summary, or the full documentation, this was work that was done by the Health Information Management Association, which is a giant health IT association that's really trying to move into social determinants. Really move into social determinants, and is beginning to ask those questions. So our health partners are beginning to look at that. So we had the opportunity to really look across the various domains and to see what was common. Because if you think about education or public health, public safety, they're each operating in their own silo as well. However, as we're looking at creating interoperability and ultimately using that more effectively, there are commonalities both from a technical perspective, a legal perspective, from an organizational governance perspective. We need to be curious learners about what drives them. And as we build our systems or enhance them, we need to be cognizant of what's driving the other folks and to make sure it's translatable. In the training, you probably saw this little exercise here with Ms. Smith and her particular situation, opioid situation, car crash, stuff happened. It's simple in its own right, but what it does do is it does really amplify, again, if you're already aware of it, it's obvious for folks who are coming into this work, that we're really touching across those different silos. And this is individually, this is not even necessarily like with a hurricane or an earthquake or a tornado or something dramatic that's happening, where we're actually touching the various domains. We don't bring that macro perspective to it. And this is in a micro way, something important to really think about here. And as we, again, this is just another slide from the training, what are the needs and opportunities and hurdles for better data sharing across the domains? And as we think about those things, it becomes a conscious activity. How do we do that? And how do we bring our partners into the conversation to effectively share that the people we're serving, are also touching their system. So you have a common client in the mix here. And I thought that was useful for folks to think about it. Again, a couple of questions for consideration. Who do you exchange information with various domains? Within the various domains, which do you exchange most and least frequently? I'm hoping that as you're going through this, you're thinking about, gee, we really need this other kinds of information. Who else, and within the other domains, again, to expand your thinking about it, can we reach out to it? How do we do it in a way that's effective to us? And as we dive a little deeper into this work, this concept of wrong pockets. I'm pretty sure that's a concept most people have either heard specifically or are thinking about, which is, my division pays for a service that benefits somebody else in a different system. And the way our organizations are currently structured doesn't really allow us, doesn't really incentivize that, because the incentives and the rewards are allocated generally according to who pays for it. Whereas if you invest, somebody else, if justice invests, in community policing and fewer people are incarcerated, that means more resources within the Human Services Department. How are those things accounted for, and how are they distributed? How are they recognized? And that comes back down to procurement, comes down to measuring outcomes, and it's a gnarly problem, needless to say, but one that's really got to be top of mind as we think about blending and braiding these areas. A couple of years ago, the National Academies of Science and Medicine put out commissioned a paper on procuring interoperability. It was a fascinating kind of read on that, which was the way we're buying things now is still in silos. We need a different mindset of how we're actually purchasing and procuring, whether or not it's the case management system or technologies, and really think differently about how those things interact. So it sort of lowers some of the barriers and hurdles associated with that. And we can make that report available. I thought it was fascinating. As you think about from a leadership perspective, how do we think about these things differently? The last section we're going to talk about here, kind of a review, is the system of systems, which a lot of people spoke about at the outset of this. And there's a couple of slides in here from work that we did with Hopkins, and for those of you who saw the video, it really is based on this simple question, which is the fundamental problem we're trying to solve in many ways is crossing the silos. And how we do that is the age-old problem here. There are no efficiencies right now, or few, to integrate across clients, programs, and jurisdictions. And so we don't have a good means of doing that. The idea of systems obviously is to look at, and this is just a sort of a horrific image of the actual systems that most counties or states have to deal with in terms of the various systems and the various systems within those systems. Misha, question or comment?
Yes, I have a question. So as I was listening to this part of the module, I was thinking about how we would, if we achieved interoperability at some point within our department and across our departments, I was thinking about how we would actually inform our consumers of this and get their consent around it. Because right now we're consenting clients, where clients are consenting to share their data with our particular unit. And I think that many times, I mean, if our data is going to be shared across units, across departments, let alone across programs, how do we decipher if they are giving us consent for that?
So that's a really important point. And one of the things that we'll want to talk about a little bit more, and perhaps in an additional segment, is that idea of consent. I think I alluded to it last time, is that one of the things we're working on is, well, one of the things we published is a privacy and confidentiality module that starts to deal with some of the basics of it. But more importantly is the idea of creating a solution for acquiring consent and revoking consent. Very important. I think it's the crux of all of this challenges here, is that we're really thinking about how to do that. So we can share that with you. In fact, we're about to publish a scan that we're just literally finishing this week that talks a lot about consent and the various elements of it, who's making progress across the country on that. And we're delighted to share that with you. Maybe even a good topic of conversation. Joanne.
Hi, I'm Joanne Barnes from Montgomery County.
Yep.
For me, when I look at this diagram, the elephant in the room still continues to be the relationship with the local school system. Even though we agree and we say we agree on paper, it is difficult to get that data together between human services and the schools so that we know where to focus, or that we can reach those that we've identified as needing support through the schools. I mean, to me, that's one of the attractions of interoptimization. It is to be able to overcome that. I think we've done a lot of work here to set up data sharing agreements, but there's still a wall that we're finding it difficult to conquer.
Sure. I'm not sure how many places have actually made a lot of progress. So I think in many ways, there's a lot of work on the forefront.
Could I offer? I think we had a session last week with Erin Dalton from Allegheny. I just wanted to remind folks that they have made progress with their school system. I also thought, and maybe Joanne, I'm wrong, I thought we had an MOU with MCPS that sort of spoke to the early warning indicators and the HHS and the schools exchanging data around that. So maybe I'm wrong. I just wanted to say, Daniel, that folks were connecting in places.
Yeah, and we do, but even as that document is on paper and signed, as leaders have changed in the organization, they have, what's the word I want to say? They've questioned the validity of that agreement, and whether it's, really legal and at what level we can share. New attorneys have new opinions. So it's still a struggle.
Yeah, got it. Understood. Tammy, you have your hand up. Danielle, just in case you can't see. Yeah.
Yeah, I had a follow-up question, which is, it's interesting that your main challenge seems to be with education systems. And I was just wondering if, I think for some other jurisdictions, the problems go beyond education, and that in general, within government, we often have just barriers to sharing, barriers in culture and in practice to be able to share across our systems, even beyond education, criminal justice, I guess social services and health is sometimes a little easier to share. But I was just wondering about other people's experiences, if in general your challenges have been with education, or if it's really, for others, multiple systems.
I think what I've seen, what we've seen, is that depending on the jurisdiction, some make progress in some areas, and and others in other areas, and depending what part of the proverbial elephant you're trying to eat, for a better term, you're starting in a different place. And part of that, part of the idea of the National Interoperability Collaborative particularly Kresge's recognition and support for that was that idea of trying to bring those best practices, or at least the attempts to do that work together. And I think what we can do over, as we proceed today and over time is kind of share more of that and point you in those directions, because it's giant, and again, part of this comes back to consent and how we arrange and develop those sharing agreements, and are they durable enough? So I'll take one more question. Nita, do you want to make another comment?
Sorry.
No problem.
So we did, and I'm happy to share it with anybody. We've been doing this work with what we call the safety net nonprofits. We contract out a lot of our work just to nonprofit organizations. So we have homeless shelter providers and substance use, treatment providers, and we've done this work over the last 5 years called Bridges Out of Poverty, which comes from a group out west, but we developed a universal release of information form.
Right.
And I'm happy to share it with anyone, which we actually got our county attorney to approve, which was a miracle. But the schools are still not part of it. Schools and the hospital, basically is another one that's often reluctant. But when the individual gives the approval, and we have like every organization listed on there, that they could possibly interface with. And when the individual gives the authorization to share the information, or, that really helps, because it's, their own volition, which seems to override a lot of things.
Yeah, and it's that effort to, I think all the study that's been done, people want us to be sharing their information. There's an expectation generally that we are doing it. When we're not, there's at minimum, they're surprised. And more broadly, they're, we're all filling out the same paperwork all the time. That is, again, a major area of consent. We'd love it if you'd be able to share that release. I think it's, again, a really useful document that I think can really advance people's work and sort of fit into it, especially as we move forward. So I'm going to push forward a little bit here, keep the questions and comments. This is just another illustration of the complexity of siloed views. I don't need to tell you, those of you who are involved with multiple agencies, funding, and those kinds of things. It goes on and on. I just want to say two things before we move to the next section on system of systems. And I hope this sort of, I know it did, and I hope it, for those of you who are going to have a chance to dive into this, it sort of stimulated your thinking around how literally is the whole greater than the sum of the parts. Because again, the whole silo approach to stuff is, it's hackneyed already. Charles talks about this idea of, within the military of, Army, Navy, and Army, Navy, and Air Force, working within their own systems, and yet being able to come together to be able to share on mission critical kinds of things. That idea of systems, the whole being the greater sum of the parts, is really the foundation of this work in many ways. How do we design that in a way that is taking into account of that, especially since none of the federal FOAs really do that. Very few states really, sort of push for that kind of interoperability and that whole kind of systems approach. Jessica?
Yeah, I just had sort of a thought as you were talking that, at least in my mind, and maybe this is relevant for others in local jurisdictions in terms of the response to COVID and the ways that different systems had to come together to really collaborate and cooperate in real time without an ability to do a lot of pre-planning. I mean, there are public health plans, but all of that came together, and I think maybe demonstrates your point about systems of systems and the whole being greater than the sum of its parts, because no one entity could tackle that public health emergency on its own. So just a comment.
No, that's great. I'm hoping that COVID, unfortunately, COVID really gave way for this idea of consent and creating kind of a universal utility for that, because it addresses many of the issues from data sharing to governance to technology that need to share that. And there's been no bigger object lesson when we thought opioids was going to be the be all end all on that. Now we, we had to deal with the COVID here. So one thing I want to share, where we don't have time to go into again here, is years ago when we worked with the Administration for Children and Families, there was this idea when we were starting to develop this work of a national human services interoperability architecture. And this kind of gets into the weeds here, but it's the idea of saying, how do we think about human services in a way that there could actually be a national architecture that guides states and communities to design and develop and build stuff that is building on the prior knowledge and experience. And this has come up recently now, last year or so, on how do we pick that up and brush it off and modernize it. And it's built on Medicaid. So many of the programs we use are involved with include Medicaid and Medicaid funding. And I believe there's a lot of funding potential out there for sustainability around this interoperability work that could come from Medicaid if we know how to look for it, if we know where to look and we know how to access the dollars. And there's a very deep body of knowledge here. Again, we did work with Hopkins Applied Physics Lab on applying the system of systems concepts here. And there's stuff like, can you share business processes and information and technology and infrastructure? It contemplates all this stuff. It's actually still on the ACF website. We'll make sure to make this, for those who are interested, we'll provide a link to it. And there's quite a bit of engineering sort of thinking that goes into it. I know this is not everybody's cup of tea, but for those who are thinking about systems, there's some really good models out there that, with the change in administrations, things tend to get lost. So we've been able to sort of keep that in front of mind and sort of pushing this forward. So you don't have to recreate all the time. You can kind of contribute to the whole. Again, this is kind of an additional piece of thinking about actually implementation on systems work that may be useful for and interesting to some folks. So again, that comes back to the overall concept of interoperability. Is what do you do with the data when you bring it together? And how do we make sure we're thinking about that as well? And that's really the foundation of this course, is not only do you have to build it and connect it, but how do we use it? How do we make sure everybody else who's exposed to it can use it? So I want to do, I want to spend a little bit of time now. We're going to adjust our scheduling a little bit to really think about these questions. We asked in the last time for you guys to think about how could information sharing and collaboration amongst the multiple different systems make a real difference in your work. And I would like, and I think Gillian, we're ready to do this. We're gonna break you guys into your county groups just for a few minutes, like maybe 10 minutes, just to kind of reflect on the conversation or what I've been rambling on about, the conversation we've had so far. What is one opportunity? What's one hurdle that comes to mind now? Very present centered about this work that you as a group or individually, ideally as a county, as a group, really are what you're really grappling with. You heard about education, really connecting education. Is that the one? Is it because of FERPA? Is it because of governance? Is it because of the technology? And then we'll come back together quickly, and we'll have a slightly, continue the conversation. I know what other people's challenges and hurdles are, and to continue this kind of group learning. So much good stuff has come out of that already. So I think that it's a worthwhile use of time. Any questions before we get started here? Gillian, are we ready to break people into groups who we may come join you and listen in on your conversations? We'll give you a 2-minute warning, and then we'll just send you to the groups. If you, for whatever reason, you end up in the main lobby, we'll be able to push you over into the group that you belong in, or another group that you want to join.
All right, are y'all? We're gonna whisk you away. Ready, set, go.
We have a few people who are not joined. Uma, who do you want to join? You want to join a group?
No, I'm hanging out with you guys.
We don't have many people for Solana County.
How many do we have?
Send Jessica to Hennepin. Send Jessica to Hennepin.
Yeah, she hasn't joined yet. She might have stepped away. Same with Connor and Michael. They're assigned, but it just looks like they're maybe not at their computers to click on that.
Do you push
It
them over
looks like
there?
he froze.
No, I can't move them.
Okay,
I mean, they're assigned there. They just have to move themselves.
okay. So it looks like Montgomery is in good shape. Hennepin, Arlington's in good shape. Alameda's got 3 folks. Somebody just.
Oh, there they go.
So I wouldn't mind joining. I know there's Cheryl and James and Solano. Hennepin, Montgomery, and Arlington are good. Alameda's good. Adam, do you want to go talk to Solano?
I'll go anywhere you tell me to go.
Oh, bless yourself.
All right, so you want me to send Adam to Solano?
Send them there.
Okay.
Oh, then send me to Montgomery. It's been too long since I've hung out with anybody.
Ah,
Probably
all right.
shouldn't go there, but I will.
Send the girl back home. Send the girl back home.
All right.
Daniel, you just want to give them, you said 10 minutes, right? Or do you want to lessen the time since we went over?
We're gonna get David here. Where's he from? Ricardo David. He's in Alameda, so he can join. We can assign him to Alameda when he comes on.
Okay.
I think. Oh, are you checking time?
1 hour left. So you wanted 45 minutes for this section. And then another 45, you wanted, we have an hour and a half left. Oh, hi, Ricardo. We're just in breakout, so I'm going to move you to your county, which is Alameda. He might be in the car. I'm not sure. Oh, there he goes.
Oh, there.
So yeah, there's an hour and a half left of content and 1 hour left of meeting time.
Okay. Cooking now.
Yeah.
One of the things we can do is we can. I think the end part won't take 15 minutes, and I think we can just moderate the general conversation. We don't need to give it 35 minutes. I think we had more engagement than. I mean, it was great. You know, people engaged in thinking about stuff. Some good resources. So let's trim down. We can listen and can listen to the conversation as it's happening following this, and then trim like 15 minutes off of that, unless it's super engaged.
So we'll make the big discussion 30 minutes.
I think it can be less than that.
Okay.
Like even like 15 or 20.
Okay.
So you and I can just sort of check in on that.
Okay. And then, so they've been in there for what? I didn't see what time it was. Maybe 2 minutes?
Yeah. I set my alarm, so there's got another 6 minutes or so. Just to give them a chance to chat amongst themselves here.
Okay.
You want to go drop, or you want to stay there and wait for someone to, if anyone pops in?
I can stay here and I can send them a 2-minute warning message in 4 minutes?
Yeah, about that.
Okay, so what?
That sounds about right.
Okay.
I'm gonna go hop in on Alameda.
Okay. Hmm.
Can I just add, because I was part of that same conversation, can I just add that what was clear was that, and this harkens to the consent work that Stewart's is doing right now, it's clear that people aren't 100% sure of what can I do under HIPAA and what can't I do under HIPAA, what information can be exchanged with whom. That information, which we would love to be sort of basic, oh yeah, I can do this and I can't do that, is more amorphous than that. And I think that's got to be a showstopper for a lot of people.
Well, I'm going to, I just put in here, this is actually very timely here. I just put into the chat a reference. Let me see if I can see my stuff here. I'm going to just show it to you because I think as Adam was saying, as we're doing this work on consent, because consent is like the foundation of so much stuff. And so Chris Albatrani, who's been working with us and now is at the Network for Public Health Law, that if you're not familiar with, they do a lot of work in this area. They're great resources. She just published this post here on HIPAA privacy actually available. It allows care coordination, sharing of information outside of covered entities. It's a very, it addresses that point right at the heart of the matter here. So I was really delighted to see this. I don't know if other folks have seen this or not, but as I said, I put the reference in the chat here because of the relevance of that particular kind of thing.
So Daniel, Montgomery County actually built its entire privacy confidentiality policy, data sharing policy. Our county attorney actually anchored it on this provision in HIPAA, 13 years ago, where we actually said for purposes of treatment, you can share information with providers of social services. So that was actually the very cornerstone of the policy itself.
So there you go.
Thanks. I think that's I think that's been a like a point of like contention and like discussion for us, and at least in Solano County is. So this is, thank you, super helpful for sharing this. Like I haven't read this before. I'm going to read over it, but I think that's been one of the questions we have is like if you're not like providing like direct care, right, like primary care to someone, can you see some of this information? And some of this information may not necessarily be a person's diagnosis, right? It may just be like their phone number, their address, like how do you you know what I mean, like kind of more basic information. So thank you.
Or administrative kind of stuff. Yeah, right. What you need to know, be able to contact them or what service they're involved with. So thanks for that. And I think we'll be embedding some of that also in the privacy course as well. Other thoughts?
I'll just add that.
Yeah.
A thought that came to my mind was, I wonder how much of the HIPAA privacy role encourages us to data share, and then how much of just the complexity of understanding everything under there makes us risk adverse, to do that data sharing. Not looking for answers, but it's just a thought or something I'm wondering.
Well, I think that there's, it is the Portability Act, right? So it does Health Information Portability Act. So it sort of envisions sharing information. I think that the lack of knowledge or the lack of familiarity or comfort around what the laws actually allow inhibit it, and I think that oftentimes, without being too cynical about it, that, attorneys want to manage risk to zero or as close to zero as possible. So, we've all heard the answer is no. Now, what's your question? UMA and Montgomery has done that. There's places that obviously have made progress over time, sort of bumping up against that and being able to sort of point at those successes. I think in some ways sometimes can help certainly privacy officers sort of at least hear the conversation. And I know now that there's interest from the Office of the National Coordinator, which sets health IT policy in a lot of ways, that is now beginning to think about these topics and trying to embed them a little bit more into sort of the rules and regulations and articulating them from from a federal source. I know that's something that people have often said is, well, just tell us what we can do, right? Give us the interpretation. So that's beginning to move a little bit.
I just jump in for a quick sec to Cheryl Esters. Cheryl,
Yes.
when you look at this doc, let me know to the point of the question we were discussing in our group, if that has the information that we discussed, or whether you want more, because we do have more.
Okay, thank you, Adam.
Yep.
So who's got something else? What, I was listening to one conversation, it sounded more like a systems question around, man, how do we even get to this? Because our partners in the other programs or agencies, we're not even connected to them enough, right? Or we're not, there's a different perspective on who we're trying to serve or how we're trying to serve folks. Are those kind of questions still relevant or still pertinent in your conversations as you're doing this cross system work? And I think it comes back to systems thinking, but was that something that folks were thinking about more? Yeah, Anita.
I welcome my comrades here to jump in if they want to, but we know the big elephants, that we need to pretty much tackle. I mean, the good thing about having an integrated Department of Human Services is that we have within our control, pretty much not control, we are one unified department, so we can access a lot of the public health, behavioral health, housing, child welfare, all that's within our orbit. And the ones that are the biggies that are external to our orbit are, the hospital, the schools, the courts, especially the juvenile domestic relations court, which has our child protective services cases, our domestic violence cases, and the schools, because, we have so many children who, if we want to do a better job at prevention and the school is lacking social work capacity, which it does in Arlington, we could actually be of assistance to them. The one area that we thought that would be coming up to us this year, which I don't know if other states are dealing with this, but in Virginia, there's something called the Marcus Alert mandate, which is basically to have a clinical social worker responding to police calls, so that it's not the police going out. This was prompted by an unnecessary death of a person named Marcus. Anyway, so we are actually now staffing somebody, we have a clinical social worker staffed at the 911 emergency center. And, listening to Allegheny County the other day, I'm sure there's some probability there about, if you know how many calls a certain household is making to the 911, we need to get those people on our radar screen. So I'm hopeful that as we move in a closer relationship with 911 and police, we'll be able to convince them that since we're going to be responding, we need the access to that information. So I don't know if that even answered your question. I just was rambling. I'm sorry.
Oh, absolutely informative. I think those three areas in particular, hospitals, the healthcare systems themselves, schools and justice are always a challenge. I mean, they're not part of the integrated system. Although it did raise an interesting question, and maybe you know this or others know this. You're an integrated county. Hennepin, are you guys integrated? Are you fully integrated across HHS? I'm curious. Alameda, I think behavioral health is still outside, right? or healthcare is outside of your department? As now?
Yes, I believe so.
Well,
This is Jessica from Hennepin. We have human services is essentially integrated with all of the human service systems, including child protection, and behavioral health is there as well. And then, you know, the Hennepin County model attempts to also integrate the healthcare with the large hospital system, Hennepin Healthcare.
This is Angela with Alameda County. Under our Health and Human Service Agency, in our agency, we call it Healthcare Services, but it's Health and Human Services. So behavioral health, public health, and environmental health, and indigent health services are all under Healthcare Services Agency. And then social services is separate and apart.
Yeah, I wonder if there's ever, go ahead, sorry.
In Montgomery County, we're much like Angela described, except that social services is a part of it. And it also includes school health.
Yeah, I know that there was a lot of conversation a number of years ago in California, actually, in particular, those counties that were integrated and those that were not. And I remember having this conversation. I don't remember if we had this conversation ourselves or not, but you know, looking at those counties that are actually integrated, what you can get done because you're an integrated county versus those that are not, and the similarities and differences there. Remember that?
Yep, I do. I think there are several nuances, right? State administered, state supervised jurisdictions.
Right.
State supervised, county administered jurisdictions, the latitude that you have to go across silos to integrate. And then, like you said, Daniel, the structure of what's inside the enterprise versus what's outside. I've actually experienced jurisdictions where you have a deputy county administrator for health and human services who's done a pretty good job of integrating everything. And then you could have an quote unquote integrated health and human services structure and everyone's super siloed underneath of that. So I think it has to do with structure, it has to do with leadership, it has to do with policy permissions, it has to do with the risk, you know, sort of resilience, for lack of a better word. You know, I mean, all of these things come together, I think, to determine how. And then over time, if you have a certain culture, then you keep building on it, you know. And we just had that conversation with Allegheny last week. They have gone so much further ahead in the last 3 years in terms of what they're doing. Because when I left, they were still talking about predictive analytics and child welfare. And to Anita's point, they've taken that to all kinds of other spaces in very safe ways. That was like, actually everyone was salivating over what they had accomplished, you know. So it's really pretty remarkable.
Continuity of leadership, and continuity of organizations is a big driver of that.
Yeah.
Great. Any other reflections on this question that from your county's perspective that sort of percolate up to the top, that either addressing or beginning to realize might need more focus or attention?
This is Jessica from Hennepin, and I guess I would just say I sort of mentioned this last week in our Kresge presentation as well, but you know, we think about the data and actually starting with the question of data is the wrong question. I mean, it's starting with what are the outcomes that we're looking to achieve and what are the goals of the individual organizations, and that has been that's come out in this training. But you know, the data is a necessary, and the data infrastructure is a necessary, but it's not sufficient. And you still have to have, in a lot of the examples I've heard others talking about, I think, you know, in the end, it boils down to, it is about relationships. It's about building relationships and professional relationships over a period of years, and trust, and you know, and I think we can't lose sight of that piece of it as well.
I think so many of us in this call have made strides in some ways, maybe not 100, none of us are exactly 100%, but I can't help but thinking interoptimization, I know I keep saying it wrong. A session for legal teams that work with human services, and a session for, maybe the legal folks with the chief administrative officers, or, someone at that level on the mayor's staff or something like that, would be a good group to have, to get them to embrace this concept so that they can find ways to help us achieve, what we're trying to achieve, and to fill in the gaps, because I think we have made a lot of progress over the years, but we're not quite there on some important issues that we need to address as we look more closely at social determinants of health and how it impacts how we do our business. That's just a parking lot commentary, I guess.
Yeah, no, we're going to get to that in a minute. Actual, some specific ways to maybe help those kind of conversations happen. A second, Joanne. Let me turn to Misha.
Hi, yes, I just wanted to really highlight Joanne's comment, because I think that would be really helpful to have people at that level embrace this concept. I know one of my team members and I also were talking about a barrier that we have with state systems. He had some examples and I have some examples from MPCAH, where what's ironic as well is that the state also has initiatives, they fund us for initiatives where data sharing would be very, very valuable to move the needle on many of the outcomes they want us to reach through these initiatives. So how can we organize and advocate for them to open up their systems so that we can share data with each other and actually, meet the outcomes that they're paying us to meet? So sometimes it's a little, I'm surprised that their systems are so closed when they pay us to move the needle forward on things where it would be so wonderful to have integrated systems.
Well, just a little side note on that. In California, there's actually some interest within the state legislature, within actually education and the state Senate staff who are interested in this curriculum. Because of that very point, there's a recognition now that the policies and regulations and funding is still being developed in silos, and there's now this growing recognition that different different sort of areas need to really connect, and those conversations are just beginning to happen, which is great, because I think that needs to be driven. It needs to be driven from the organization, needs to understand it, but also from funding and finance, as well as state legislation to encourage that. So there's a little bit of activity going on at that level, which I think will potentially yield dividends as the leadership begins to think about how do they braid and blend funding or create the space for improving data sharing. Yeah, Steve.
Yeah, thank you. I actually think I raised up the clapping sign rather than the hand.
Yeah, okay. I figured it was either.
I really appreciated what you were just saying, Daniel. So there you go.
Okay, great.
The thing that keeps coming to my mind, and I know we're going to talk about human-centered design at some point soon.
Yeah. Very soon.
But I keep wondering, because I naturally have a human-centered design focus in the work that I do and the way I think. So I keep wondering, where is the interface of that within what we've already been talking about? There's been understandably a very operationally behind the curtain focus on everything, the concepts we've been talking about to this point. But I almost see it as, before you even can talk intelligently about what systems should we be converging and what data do we need to align, you need to understand the experience of the consumer, the customer, the client, in order to inform that discussion. So I'm almost wondering if the, you know, the human-centered design voice of the customer piece should come at the genesis of this as opposed to somewhere along in the process. So maybe that is the intent and we just haven't gotten there yet, but that's what keeps flooding into my mind as we talk.
Perfect segue. No, thank you for that. Thank you for that. I'm actually, we're gonna turn to that right now, because there's always a debate in my mind of do you go macro to micro, do you go micro to macro, or, you know, how do you present this material in a way, because everybody learns differently. You know, some people want the big picture and then they want to get the details. Some people want to see the details and the connections, and then that. So you kind of have to judge that for yourself and your audiences. At the end of the day, it's kind of the gestalt. You can kind of hold your attention over a lot of different moving parts and concepts, because this is really complicated stuff. I don't have to tell you, you're in the middle of it every day, and you're running organizations trying to, you know, do the work and also plan where it's going. It's complicated. There's no doubt about that. So let me switch. We've got a half an hour left, and I want to show you some of the ways we're thinking about that, and what you're going to see in the next version, in the next part of this particular section of the training here. This is just a sort of a theory of change, and I'm going to show you some of the next 3 or 4 or 5 slides are, again, conceptual, but they're can be very useful as you are having the conversation, both with your colleagues, people who work for you, people you work with, other organizations. And this simply is a way to sort of organize the world, not the whole world, but it's part of the world, simply in what are we talking about here, right? Sometimes we have conversations, they're policy conversations, they're structural conversations, they're practice-related conversations, and we don't define the terms. So here we've tried to say, you know, if you're in a conversation and somebody's talking about the policy implications of it, and you're talking about how does that actually get implemented, you likely have a potential disconnect here. And so part of it is just defining up front, like, hey, but this is a policy conversation. It's going to have implications, what we do, but let's think about it from those terms. The other couple of sections on the graphic here are, as we think about what we're trying to accomplish, are we thinking about outcomes orientation, which is, you know, metrics and very clear goals, define time frames, who's doing what to whom, you know, and can you measure that, as opposed to an innovation? People are always talking about innovation, and yet there's no necessarily defined end to innovation. Sometimes it's successful, sometimes it crashes and burns. You have to be ready to say, we're moving into an innovation mode here. We don't necessarily have the metrics, or we think we have the metrics, but they may not occur because we're in new territory. And the other part is it kind of an evolutionary, incremental, we're going to move 5% a year, or are we going to like blow the thing up and start over again as 2 domains? So in this one graphic, there's a way to think about, so almost like the dials, you know, what are we talking about? Are we thinking more about outcomes versus innovation? Is it quick? Is it slow? So it's almost like a norming conversation as you get into policy or strategy here that can be useful. Again, some of this is language oriented so that we can agree on it. And the model is transfer, you know, it can be adapted to other ways you want to think about it. So this is just sort of an ingoing concept. The idea of interoperability and human-centered design starts with this concept, which I think is also the pinwheel just defined in terms of the people here. We've used this image a lot, and I may have mentioned to you, sometimes I've had the opportunity to talk with people about interoperability or interoptimability, and it just goes over there. They don't know what they're, too many words, too many syllables. This is as clear and distinct as you can say. There's a family, a mom, a daughter, and a granddaughter who are involved with multiple systems and have multiple needs. How do we connect the dots? You know, that's interoperability. You know, it's how do you bring the people and the systems together? Again, you guys are working on this all the time, but it dimensionalizes. If this is one family within, you know, a state that's got millions of families, how do we really think about being able to automate that? How do we think about being able to bring systems thinking to the table, because you're trying to solve this problem multiple millions of times? And I think what you'll see is in the training we focus on this family, and there's a little dialogue that happens, kind of the situation, and sort of poses some questions for you. it helps from a human-centered design perspective. We go into more details around it. Is who are we serving, right? Who are we attempting to? I'm going to show you actually one other image that I want to show you that's not in there. That is, I think, very useful in terms of human-centered design. This is actually the exercise that we used in Connecticut with the Department of Social Services here. So we took this idea of a family, the other family, the Garcia family, which is going to show up in the training and kind of walks you through the same kind of thing. Here is Connecticut was trying to design a specific unit that was sort of an integrated services unit, and that had people from finance, from legal, from practice, from policy, from technology together. What we needed to do, which we did, was to create this scenario called the Benson family that was complicated family receiving multiple different services from different agencies. And so this becomes an exercise, which you'll see, that allows you to actually engage in the conversation. Like, what do we know about the Bensons? What do we need to know, and what do our systems tell us about them? So this begins the conversation of actually visualizing the family, right? Who is it that we're serving? What do we know about them? Anita, you said that before. You looked on a census tract basis. What do we know about the social determinants in that community, right? Well, this takes it to the next level. You could actually look at families like the Bensons who are in this situation. You probably did some of that work there, and others have done that as well. So how many Benson type families, how many Garcia type families do we actually have that we're trying to serve? What are their particular characteristics? This gives people a way who are not necessarily case carrying practitioners to be able to understand who they're serving. You can't have everybody out in the field doing, ride along visits or necessarily focus groups, but many times people take these kinds of, again, visualizations, graphics, and actually put them in their offices, right? So put it in front of people so they can visually see it, because so many people are visual thinkers here along the way. And in fact, Connecticut had this strategic plan that included the Bensons in their lobby, and everybody received a copy of it, so that all 1,600 people in the organization got a copy of this kind of work so they could refer back to it. It makes it more human in a way, and it makes people who are a little farther away from the actual care management to recognize that they're actual specific human beings in the process here. So we go into a little bit more detail on that. And there's a couple of activities that we talk about. In this sense, again, it's the conversation between individuals and programs and units that are particularly useful. So do we know who the individual and family are? What do we know or what don't we know about their lifestyles? Our data systems give us a tiny bit of information, right? Maybe about income, involvement with systems, but do we know what their community's resources are? Do you know what their supports are? Do you know what their hopes and fears are? So you can begin to engage in that conversation. And do we have the means to actually acquire, sort of investigate and acquire that? And so, within that scenario, there are the personas, the different families. How do we integrate those into our work? When you look at this work more broadly, and there's a lot of this came out of the, sort of the software development world as well. People create literally, cutouts. They put them in the offices. You see the people. You can create a Facebook page around it. You can actually create, that person. So when you're actually having the conversations, you're thinking about who they are and how you're serving them. A couple more slides here that are relevant. So this is useful to think about individually and to think about it in the context of your overall organization. This next slide, for those of you who've seen our work for a long time, is something that is actually grew out of the Allegheny work we did. We were able to study their system years ago and wrote a case study on them. And one of the things in Allegheny and San Diego and Hennepin actually, and Montgomery and a lot of other leading counties back then, where leadership actually was paying attention to all of these, what we term change drivers. This is probably one of the more important sort of slides and a lot of the work that follows this is based on this. What we found was that these were almost, but they were actually levers in terms of how the organization was proceeding. Any one of these things is obvious. You know, you say, oh yeah, so, you know, how are we doing on privacy? How are we doing on, you know, performance management? But when you put them together, all together, you begin to get a comprehensive view of the complexity and the moving parts and pieces of this. And so whether you come in for, you know, any door you happen to come in through, whether it's a child welfare or adult protection or health, these drivers affect our ability to serve that individual, whether or not our systems are connected, whether or not we've got the communication, the governance, the leadership, whether or not we're person-centered, they're all incredibly relevant. So you say, that's great, that's useful. Now, how do we operationalize this? And this is the, in a way, the magic sauce from the work we've done over the years that I think is one of the more transferable parts of it. One needs to know how you're doing on this, right? Some people may have, you know, maybe doing surveys, maybe doing staff surveys, maybe doing analysis of how the organization is proceeding, the competency of the organization. Many places don't do that. You don't have the time for it. Theoretically, it's part of the strategic action planning process that you have to conduct. But what we found was that there wasn't really that kind of in-depth knowledge or metrics around it. So we, in a sense, archaeologically sort of distill these categories, and they may be, you know, pretty comprehensive. There's stuff I'm sure that's not showing up in here, but that could be fitted into it. It's a way to share with organization leadership and then the organization what we're paying attention to. So behind each of these drivers, we've developed a rubric. So again, on a kind of a 1 to 5 scale, how are we doing here, right? In terms of a set of metrics that everybody can agree on in terms of the level of maturity, right? So are we at the beginning stages? Are we, you know, we are in the needs development? Are we in the competency? Are we in the proficiency? Or have we been able to master this particular driver? And this becomes a part of the exercise that both from either from a qualitative perspective or from a quantitative perspective, organizations can go through and actually develop a baseline. And that's what this is. This is one of the tools that I think we found to be incredibly useful. It's very intuitive, but it's also a good way of getting organization alignment around what's most important from a what are we going to go do perspective. So if you think about each of those 10 drivers and you assess them on that, these criteria in terms of its level of importance, somewhat important, very important, critically important, and the level of maturity around that, using the rubric, you can actually place that driver in one of the quadrants. So you can say, let's just take, for easy purposes, technology. Where do we sit on technology? And one could say that it's a critically important driver. And yet some people feel like they've got the handle on it. Some people think we're doing pretty well. Some people think we're not doing well, depending who you talk to. This gives you a way to actually get a consensus, either again, qualitatively from the expertise in the room and or actually implementing a quantitative survey, which we've developed. It allows you to actually give it a number. You know, we're at 2.4. Now you've got a baseline. You've also got a sense of where you have your development needs, where you're going to focus your attention, and where you agree that we're okay. You know, this is sufficient. But a couple of these outliers, we really need to focus our attention on. It's useful because it allows the organization to very quickly get a snapshot of where you're at, create a baseline, so that as you make progress, you can also continue to refer back to it, but you can actually measure it over time. You can say, have we made progress in that area? And how do we know if we made progress? And that's where the quantitative assessment part of it goes. So I offer this up as actually a recommendation between now and the next session, is for your teams to get together to think about these, to think about the drivers, read about the drivers. There's a definition of them. There's a short and long definition of them. And there's also a rubric that is continuing to evolve. And I know there's commentary about equity here and how do we address equity in these. And it's a maybe a ubiquitous sort of filter that we're bringing to this. I'm not sure it's a separate driver. We put it in with workforce right now, but how does it apply across all of these is a question that I think is still very much top of mind. Let me pause for a second here before I move to the next section here and see if there's any thoughts, reflections, questions, clarifications. What are folks thinking? And what I'll say is also, you know, I'm showing you, we wanted to show you this now and kind of give you a little verbal overview. So when you see it in the module, you'll have already seen the idea, right? You can digest the idea. You can think about it more clearly as opposed to just necessarily saying, oh, this is a new idea here. So any particular responses or thoughts? So in person, the way this works is obviously a lot of this work happens probably more poignantly when people are sitting in the room together. So in terms of the baseline assessment, we've done that virtually, but you can also do it, created these giant poster boards, you know, 4x4 poster boards with people at the table actually doing the assessment qualitatively. And then it's almost like pin the tail on the donkey. Every table kind of goes up and sort of assesses where they're at. So it becomes a very interactive way of taking a fairly complex concept informed by professional experience and knowledge, and actually begins to sort of put it on the wall, literally, to see, are we in agreement? And we oftentimes hear people saying, gee, I thought X and somebody else thought Y, and there's actually is a difference of opinion. There's a lot of convergence oftentimes, which is useful, but the differences of how people are coming to what's important and what's not important is also incredibly useful. And it helps us sort of focus on those things that are, again, in need of most development, and those things that are knowing where we actually have some good strength around them. Okay, I think we're getting close to fatigue time here and lunch for those of us who are not there. So I'm going to assume that you don't have any questions at this moment in time. We can bring those questions to the table when we get together again. And I hope that you are able to think about this as a group in your county. Again, from the human-centered design perspective and the personas, how do you adapt that to your particular county? Those kinds of things, to the language around conceptual models, to the sense of drivers. Are we paying attention to all those drivers? Where do we need to go? And then creating a baseline. I think those things have been incredibly resonant in organizations. Again, from a systems perspective, what do you go do? How do you actually implement these things? And this is a way to actually get everybody around the table, whether or not you're from finance or technology or policy or practice, to look at the person or the people you're serving. And we've developed a bunch of different personas. So again, we're happy to share those with you. They're in, I think we've shared some of the links to the different graphics work, but whether or not it's foster care or adult aging or immigrant or whatever it is, we've dimensionalized those so you can really focus on who we're trying to serve and then how are we organized to actually address those needs. So what, just in the remaining time, I just want to kind of go through what we're hoping to accomplish. This out here. Here's the intersession assignment, if you would. Schedule some time to review the baseline readiness assessment tool. If there's a different piece that is more important to you, of course, you can go ahead and sort of adopt and adapt and do that. I think this is a really good exercise as you think about it. Whether or not you can get through all 10 drivers is not particularly important at this point, but to pick a few, we'll send you the rubric for the other 9 drivers. You have them in the workbook for the consumer-centered one, but we'll send you, it's basically 1 rubric per page if you want to consider that. Pick 1 or 2, kind of go through that exercise, see what that feels like, create that muscle. It also, the last thing, if it's not obvious, it creates a language. The sense of drivers creates a language that is incredibly valuable for sustainability, right? So people coming from different areas, different programs, different agencies, different departments now begin to have a common vocabulary in sense of what are we talking about? What are we paying attention to? That is, I think, a really important sustainability piece. So discuss the 10 change drivers, use a rubric to score your organization, or pick a few of them, kind of get a sense of, kind of road test it a bit. And if you can, at that point, might be useful to think about what are the highest priorities for you, or in terms of where you want to learn more. And I asked that last question in particular because we do have the ability to, and time to do individual consultation with the individual sites. So there may be an area that you want to go into some more detail on, and we can drill into that. Any of the stuff we've talked about so far are will be available for that. And I think this is the assignment there. So here's some next steps. Complete module 2, putting interoperability to work before the 3rd session, which means, kind of just going through the rest of the section. Complete the reading and some of the exercises. And then if you are able to meet with your county team ahead of time, just for an hour or something, just to sort of review that concept of baseline readiness. I think that the places we've been able to do that, whether or not it's at ACF or counties or at the state level, this is something that really resonates with folks. So prepare for and attend the 3rd seminar. Think about what really is most important to you, either the concepts or the particular applications are useful to you that you want to learn more about, or getting access to other resources. And then what we'll do is we'll finalize the schedule for consultation. So Gillian will send out a doodle, and we'll ask you guys to think about some dates that we can get together over in November, and maybe part of December. If you're interested in that kind of consultation, to focus on a particular part of the conversation, and we'll ask you to sign up for that. And we're also able to schedule some more cross-system webinar time. So we have one more session scheduled up to today. We're happy to schedule another one if there's a consensus around whether or not it's just more group sharing, or whether or not there is a particular topic that folks want to, or a couple of topics that folks want to focus on. And this is just some thinking about the consultation session. As you think about your journey forward, what's most important to you, and what, if there are any specific aspects of ITCC that you'd like to focus on during your consultation session. It's good to get that thinking about now. Over the next couple of weeks, maybe there's a consensus around that. And then in the next session, we'll spend, again, a little time reviewing those core concepts, discuss baseline readiness, and then I'll look at applying some of the concepts and tools to your individual organization. And then after that, we'll set up time for the individual site consultations and dig deeper into it. Some additional resources I had last time. We'll put this, we can share this out to folks. We can also put it on the hub. So a number of people have joined the hub. All these resources are there. The video will be there as well. And then we can get back to it. For those who are interested, and again, I'll talk more about this next time. By then we'll have published the consent. Oops, not even up there yet. I'll just share this one last document before we get off here. This again may be of relevance to you with this idea of a consent utility. How do we create a utility that can be applied at the county level or multiple counties or regional level, so that this whole issue of consent is something that everybody doesn't have to invent or reinvent for themselves. And there's some momentum around this. The scan report will be out. We'll share that with you. And if we want, maybe that will be a good opportunity to talk about that in a separate session, or join the webinar that will be scheduled for that. So we have just about 5 minutes left. I don't know if there's any commentary, thoughts, questions, reflections. Floor is open. And of course, we're available with specific email questions at any time. Happy to respond to that, or feedback and responses to anything you've heard or seen here today.
Thanks, Daniel. This is Jessica. You just provided a whole bunch of information in the last 10 minutes. Are you going to send out this homework and these tasks and in an email afterwards?
Yeah,
I was trying to write it all down.
Yeah, that's a great idea.
Okay.
Gillian, we'll take the actual assignment, put it into an email, and then we'll attach the document so you can kind of review it again if you like. But thank you for that clarification. It is a lot of information. I know that. All right, I think we have presented what we wanted to present. Glad we had some time for conversation. I've stimulated your thinking about it, and encourage you to sort of dive in. There's a lot of reading opportunities and other resources that are on there. If you have any challenges with getting into the training, or if you have any questions about it, or anything like that, feel free to email us, and we are looking forward to getting back together with you guys soon. Have a great rest of the week. Thanks so much, and look forward to seeing you in a couple of weeks.
Thank you.
Thanks, everybody.
Thank you. Bye.
Daniel, do you want Gillian and me to stay on?
Sure, that'd be great. Thanks.
Bye, everybody.
Bye, folks.